put across as plans. As far as the other point is concerned, which we found in many of them, for example, the communication between the directorates as far as the pharmaceuticals and the health one is concerned, in order to develop and build the budgets, was found also to be misaligned. The water infrastructure, again, communication also within the value chain in terms of the different responsibilities. And I will illustrate later on in the slide presentation how, for example, the Mhlabatsane Regional Water Supply Scheme, which is contained in the report, was also affected by incorrect placement of the likes of electrical connection as part of the implementation of this project, which happened on the back of poor communication as far as that one is concerned. In the other one, as far as the urban renewal program, which is the one I want to place a lot of emphasis on in this communication gap that we've identified, there were issues like where budgets were communicated, and they only realized that the funds that were actually made available for these projects were far less than what they had communicated. You'll hear that in Bekkersdal, for example, as an example in terms of this. The budget that was communicated about the extent of work that was going to be done was about 3.7 billion, but, or rather in Everton, there was a budget that was placed in terms of communication of what was going to be covered for the urban renewal. But according to the test that we have done in the audit, there was only about 260 million allocated across the whole period of this particular budget. To the same extent, if one looks at Winterfeld, there was a 4.3 billion budget, which means that you communicate what you are budgeting, what you desire. You communicate your aspirations to the community as to the quantum of the full extent of the projects that are going to be implemented, which amounted in total to about 4.3 billion. However, only 278 million was received to do the things they needed to do. And I think the same goes for Bekkersdal as well as for Alex. So I think we need to just flag this matter and say that communication, among others, has been one of the key issues, because clearly if a communication goes out that the project is worth 3.7 billion and it communicates the things that are going to be done with it, it goes without saying that when actual cash is received in respect of those projects, similar communication needs to go out to lower the expectations that were created when the aspirations were developed. And I think that's one of the key issues which we think could have created conflict in certain areas, because people felt this that they see is not worth the amount that was announced whenever these projects were announced at the time that they were. So we are highlighting this matter of communication, especially when it comes to creating and developing expectations against the reality of what, for example, 278 million rands will buy for those projects identified in Everton or Winterfeld. Another finding that is contained in our report with regards to each one of these as well, from a performance point of view, was the lack of monitoring, where because certain budgets that were communicated initially were not honored, some of the positions that were earmarked for people to do some of the monitoring work between the projects could not be made available. And when we looked for documents for some of the projects, as well as the technical approvals and certificates that were delivered by the contractors in some of these projects, many of them were nowhere to be found, because there was no proper monitoring of the deliverables in all of the projects. The progress reports associated with reporting on these projects were also not forthcoming, and hence, if you look at the urban renewal programs as well as also on the water infrastructure, the monitoring activity to also monitor the progress achieved against developed plans was largely very limited, and hence some of them did not fully appreciate or achieve what they had set out to. I spoke earlier about the extent of the budgets. Certainly, if one looks at the planning budgets for the pharmaceuticals procurement of medicals, it is largely a formula-driven budget based on previous year's budgets, and clearly it will always be out of line with what the reality of the need is, and therefore there's a need to pay attention to fixing the area of budgeting in terms of the guidelines for budgeting for pharmaceuticals. As far as the budgets on the water infrastructure were concerned, they were also a major cause of delay, to the extent that I think in many of these, because there were no funds forthcoming for a number of them, they resulted in some of the external service providers having to go under because they could not continue to operate because they were largely suffocated by lack of funds coming forth in respect of the programs. I just want to give another example. If one looks at one of the things that we've highlighted in the report in the water infrastructure, where we looked at the Greater Mbizana project bulk scheme, where, for example, because of the misalignment of the budgets and the planning cycles, if you look at the second bullet there, you find that the phase one of the bulk scheme, and we did a value chain approach here where we looked at the delivery of water infrastructure from the abstraction process, when water is abstracted from a river or a dam, right up to the water treatment, right up to the reservoir, into the reticulation system, which links to the delivery of water in the communities. So we looked at those areas of the value chain quite intensely. And if you look at the Greater Mbizana project, we observe that, for example, phase one of this project was operational as at the end of May 2014, but the reticulation component, which is phase two of this project, the build for that only commenced in January 2015. What it means is that much as the bulk of the infrastructure has been spent to do the things that precede the reticulation process, but the reticulation infrastructure was not planned for delivery at the same time as the rest of the bulk scheme in phase one of this. So some of those things, they result in an entity having spent the money transparently, but the reality, there's no water because there's no budget that has been set aside for water to be connected into the reticulation system so that it flows into the communities. And we want to highlight this because it's part of those project management failures that cause the delivery of the service not to be in place when, in fact, monies have been spent, but you find that some of the deficiencies are in the project management environment. So that was the issues that we picked up with regards to, sorry, this technology has failed me now. Find it. Big. Sorry about that, it's just a minor glitch. We'll just trying to get back to the slides.
Trying to find it.
You don't have it there? Okay, let me just carry on with this manually, it's fine. I have to adapt to, yeah, don't worry. Right, as I was saying, maybe you can try and see if you can fix it on the other side. So at least as I speak to this, we can see the stuff that I'm referring to. I was dealing with the issue of the budgeting as one of the area that we had findings. And as I said earlier on, there were examples of some of the misalignment of the planning where the bulk of your major spend is done, but the part that will actually trigger water is not done because of misaligned plans. Also in the water infrastructure, one of the major risks that we are highlighting because of the lack of the budgets is that the lack of funding is starting to also affect operations and maintenance, because whenever this water infrastructure is delivered, some people are left to do the operations and maintenance at the local level. And clearly with limited funding, the opportunity for that water to continue to be delivered is lost because the operations and maintenance, which is supposed to employ the people who will maintain and operate the infrastructure, are not in place. So you've got some infrastructure in certain places that is delivered and in place, but is not in use because there are no budgets to employ the people who are supposed to operate and maintain these projects. The staffing part of the project management and operations, which is another category of findings, we also looked at this area in terms of how are these projects managed and operationalized. In the area of pharmaceuticals, there's a matter which still persists, and that is the ongoing vacancies of pharmacy assistants, as well as the pharmacists themselves. Particularly if one looks at some of the health facilities in the rural areas, they have quite a big challenge in attracting the appropriate trained people who are able to do work in accordance with the standards of the Pharmaceutical Council. And so this is one big issue as well, which also affects operations, because as you will see in the reports that we have issued, we've also used some pictorial illustrations just to indicate what type of environments we found when we went to engage on these audits, and the type of issues that may betray the standards in terms of the storage, the security, as well as the management of the different types of pharmaceuticals which are subjected to different standards of management and control. As far as the staffing and facility and capacity management is concerned, also on the water infrastructure, clearly the whole area of lack of specialists and technically trained people to maintain the infrastructure at district municipality level is another big area of risk, in the sense that with some of this infrastructure that has been delivered, as well as the fact that it may continue to need ongoing maintenance, there are still major vacancies in those technical areas. So we are just raising this as a flag to make sure that sufficient steps are taken to increase the capacity of those technical skills, especially in the areas where this water infrastructure is fairly new, because it can easily go to damage, and we will find ourselves having to repay for the same infrastructure if the repair and maintenance program was not adhered to. The staffing, again, was also another major factor with regards to the urban renewal programs, where the basic segregation of duties were compromised in many of these programs, because people were expecting major funds that were going to flow, especially to these urban renewal programs, and many of these never materialized because the funding received was far less than what was expected, and as a result you ended up some people having to complete functions that would have been described as incompatible, where they also check their own work, because there's not many people who are supposed to go around doing this. And so with the movement of many people and the resignations in many of these projects, you ended up losing the track as well as far as the project management of these facilities was concerned. Supply chain management as well is another area. There were a number of areas, especially in the pharmaceuticals area, where we also saw some improvements, I must say. If one looks at the delayed payments to some of the national suppliers, the pharmaceuticals in terms of supply chain, the bulk of the provinces buy their pharmaceuticals through a nationally determined process where the prices and all of that is negotiated centrally. And we started seeing a reduction in the delayed payments, which means they are starting to catch up with making sure that they provide payments to their suppliers in time. There was a time also in terms of the supply chain in the health portfolio, as far as pharmaceuticals are concerned, where buyouts were quite a regular occurrence, where a lot of medicines that were needed for some of the facilities were not always available on time. And we'll give a feedback on this in terms of how the turnaround has been effected in the Department of Health. They did indeed go to great lengths to start addressing this matter, and part of it has been dealt with. Again, in the water infrastructure, as I said earlier on, many of the poor supply chain as well as late payments to suppliers resulted in many of the projects being delayed. You find a project having been delayed for some 18 months and longer, while no activity is taking place, when in fact the bulk of the resources have been committed to that project. We make an example in the report also about the Hlabisa Rural Water Supply Scheme in KwaZulu-Natal, where delays in payments resulted in financial stress of the contractors, and many of them were no longer prepared to provide the required services, and that normally causes damages to the progress and the delivery of the project. So these are some of the issues that we're highlighting in the performance audit in detail, as well as giving examples of what transactions were affected by these supply chain deficiencies. The one other point in this same category of findings for each one of them was the document management and record keeping. I think it was worse among the urban renewal programs. That's where we found the bulk of the deficiency as far as documents are concerned, to the extent that in the Alex program, although there were many things that were done with the amounts allocated, but we still had challenges in finding documents to substantiate transactions, as well as to perform further tests on the work that we had done. And that was really the bulk of it in terms of the operational side, the last point I made about the document management, because when major funds are made available for these projects and no document is forthcoming, it's difficult to get to conclusions about how effective and efficient the expenditure was. Then on the intergovernmental coordination side, as the one component that we looked at, we found that major failures as well as delays, as well as lack of timely action on many of them was largely because of many things were reduced into verbal commitments. For example, when you started evaluating the progress of these programs, especially in the urban renewal programs, there were no written commitments that were put in place to ensure that the different spheres or the different players in the system respond positively to corrective measures. And lastly, if I may just highlight some of the recommendations we've made. We have highlighted specific recommendations in the report that we believe will help improve the delivery of this infrastructure and these service delivery programs when monies are laid out for them to be delivered. And we think that these recommendations and the commitments that have been made by the leadership will go a long way to ensure that even if the full budget has not been received, but at least that which is received to carry out these programs is put in place in a manner that will protect it from being abused. So the key things that we are raising, I guess, in the reports as I conclude, is that we already have seen, among others, when we did a follow-up of this report, especially the one on pharmaceuticals in the Department of Health. We did a follow-up in the 2015-2016 year, because the year we were covering was up to 2014. And in 2015-2016, we actually found that quite a significant number of the recommendations have been implemented. An example of this, in the whole pharmaceuticals value chain, the ministry as well as the department have introduced what they call stock visibility systems and other tools that have been put in place to effect improvement in relation to those weaknesses that were identified in prior years. And we must say that the outcome of our follow-up tests indicate that this is exactly the type of medicine that was needed to fix these particular deficiencies. So we want to say that we are encouraged, as it were, especially with the portfolio of health, by the fast reaction to dealing with these matters, because they've also recognized things that are not going well with the distribution of pharmaceuticals. There are a lot of instances also, if you look at the report, which we'll think will take a bit of time, particularly the issue of bringing on board pharmacists, especially in areas where there are certain schedules of medicine that need to be dispensed by people who've got the necessary technical knowledge, including issues of storage of certain types of medicines which are not going to be kept for too long if they are stored under conditions that could destroy their usage and all that. And lastly, we will also, as we complete this performance audit, take it to the portfolio committees in the new year, because we believe that the portfolio committees have got a lot to check, particularly in this environment where there are limited fiscal resources. We think that a lot of the delays, a lot of the lack of planning, a lot of the leadership deficiency in overseeing these projects as they are implemented is that which creates opportunity for wastage. And we want to suggest that in this environment with limited fiscal resources, this is potentially the area where, without necessarily looking at the technical accounting issues, which is what our report of two weeks ago was about, but looking at the real delivery, who are the people who are making sure the things that are planned happen according to plans. That's what this focus of this report is. And we think that when we highlight these four key areas, which are about leadership oversight, which are about project management and operations, intergovernmental coordination, they have, and funding as a fourth key theme that we pick up in the report. All four of those, if one looks at them, in relation to any other project. Those are the 4 key things that matter in reducing potential wastage, in reducing potential on programs going astray. But I think the other reality which we're highlighting in the report is that it's not very useful to announce 3.7 billion budgets on some of these projects, which create 3.7 billion expectations, but when the money is received, it's only a mere 260 million. And if that 260 is not followed by subsequent communication to lower the expectations, it potentially is a dangerous weakness as well, which could make people reach conclusions that this money has gone astray when in fact it never arrived in the first place. Thank you very much.
Thanks very much, AG. While the AG is getting seated, just a reminder, the hashtag is AGSA. And we'll now take your questions. And we'll take the first set from Cape Town. Any questions from your side, Cape Town?
Yes, we do. Go ahead, Makwetu.
Take the first string.
Thank you very much, sir. It's Kimi Makwetu from Business Day. Just wanted to find out, sir, having looked at all the weaknesses, especially in the supply chain of pharmaceuticals, if there needs to be a rethink, perhaps the possibility of medicine supplies being better managed, if larger facilities are able to be ordered directly from pharmaceutical companies. Just wanted to get a sense of if the rules are maybe too stringent on the facilities in that respect, or if there's some wiggle room to maybe make adjustments to those rules. Thank you very much.
That would be it from us, Chair. Back to you.
Any questions from this side? Barry, I see you. Michael. Last one. Yes, ma'am. Barry.
Good morning, AG and panel. Barry Bateman, Eyewitness News. AG, looking at these issues that you've identified broadly, it comes down to accountability of the people involved and perhaps the skills and expertise of the people involved. Now, the situation we're in here, where we end up with these deficiencies, did not develop overnight. It is one of those slow creep things that it gets worse and worse over time, and ultimately the system collapses, where you don't have that maintenance for long. Was it established? How did we get to this situation? Who are these people being appointed, and why is there not accountability? Where someone is not doing the stock taking as they're expected to in terms of their job requirements, why was there never any steps taken when this was initially becoming a problem, to the point that we end up here where, in some instances, water infrastructure is collapsing, for example? Thank you.
Hi, Slee from Jacaranda FM. I just wanted you to elaborate a bit more on the Alexandra project, the budgets there, what is going on there, because the situation, I must say, is quite disheartening for the number of years we've been in democracy or whatever, but just what exactly is happening in Alexandra? Why is the infrastructure still so bad?
Hi, AG. Michael Apple from the NCA. The issue of announcing budgets, but knowing that the allocated budget is actually far less, what's behind this? Is this to score points with communities? Is it political grandstanding, making these big announcements only to know that money is simply not available? So what is behind this? And secondly, 63% of staff at health institutions, hospitals, clinics not recording patient details. Standard 7, Standard 8 accountant will say this is basic bookkeeping you're taught in school. How on earth is it possible that our hospitals are not recording patient details and what medicines are dispensed to them? So they don't know what medicine is in their inventory and what's gone out to which patient. Surely this must be a massive cause for concern. And are you confident that there's going to be somebody wrapped over the knuckles for this? How are these people being appointed and how are they staying in their positions? Thank you.
Thank you very much for the question. Starting with the first one from Cape Town. As far as the supply chain environment is concerned, currently, if you look at the different provinces, many of them, they have their own departmental processes where they do the procurement, the receipt, the storage, the delivery, and the accounting for pharmaceuticals. And there's only one province that still has an outsourced service provider with regards to this, and that is Mpumalanga. Otherwise, the rest of them are doing it on for themselves. One of the recommendations that we have highlighted in the report is to encourage, because these findings are largely also to encourage adoption of good practices, to encourage a process where the option for procurement of pharmaceuticals continues to be subjected to an evaluation by the department itself. We can't prescribe to them, but we can recommend that this is a useful area to look at the cost benefit. How best could they get the value for money? Is it the option of getting it with an outsourced service provider? Is it the option of doing it via a centralized process or going to buy directly? So wherever they do their assessments, I remember when the DG, we raised this matter and they started adopting the central procurement of pharmaceuticals, she shared some big numbers in terms of the savings that were secured. So I think the market will possibly change from time to time, and I think it is largely in the hands of the department, and we know that they are alive to the fact that they could extract some benefits, both in terms of the timely delivery, proper procurement and sourcing of pharmaceuticals, as well as the delivery thereof. But we do know that this is an area they are alive to. We have just made the recommendations for them to constantly appraise the route they take with regards to the supply chain of pharmaceuticals. The matter of skills and expertise, as well as the issue of the point that you've raised, Bateman. Clearly, I think if you look at a lot of these programs, in the first instance, those skills and those disciplines were not put in place to start with. So you get a project that gets set up, and it does not invest in putting the people with the appropriate skills in some instances. And I think we found the situation also where we know that in order for a particular project to work, our starting point is to say what should be in place in order for a project to work. And our inquiry is based on what that standard says. If you need to have a project manager to facilitate communication as well as to facilitate changes between the projects, if you don't have that, people are going to change the scope of work, and before you know it, a budget of 200 could become an actual expenditure of a different amount. So these are the type of issues that we are highlighting in the report. In the Alex project, this is one area, for example, if you look at the linking to the question that was raised earlier on regarding what's this issue about budgeting something and giving another. If you look at Alex, the budget that was put in for it, for example, was 2.1 billion, what was budgeted for it. And the amount spent was just about 100,000 rands more. Almost 2.2 in essence in terms of the amounts that came from different sources in there. And if I think you look at that, there's certainly a number of houses and other things that were done. It's not part of the scope of this work to assess the sufficiency of the things that ought to have been done fully in Alex. And I think when we looked at it and made inquiries and also spoke to the people that were involved, they do say, and we've seen that there's quite a lot that they had done there, but with the limited opportunity to do even more in that limited space is potentially one of the flags that has arisen, where they are starting to think about where can they start looking for additional space to do the things they still want to do. So the reality is that what they were given, they did spend, and we did follow it to the extent possible. However, the reality is that to fix the need at a social level in Alex, perhaps the issues they were raising was that there's nowhere else to put something new, as an example. So those are some of the issues that came. And it's one of those where we actually struggled to find some of the documentation to really go to the extent of getting to the detail of some of those projects. We still think that whenever the project is going to be expanded, more investment needs to go into putting the people with the skills and the expertise in place. Because with lost documentation, accountability also goes out the window. The issues that we picked up in the pharmaceutical side as far as the operations are concerned, correctly, as you have said, are largely the recording of the stuff as it moves, because if you've got an inventory management system and this inventory management system records the things as they come, and when there are issues that are made out of dispensary and there's no recording of it, the running total for those pharmaceuticals will not be accurate at any time, let alone the fact that when we test them as well, we start asking, but if there's a movement of X quantities of medication, where are the documents that show this movement in terms of issues and all of that? And we found in quite a number of these facilities, and if I may just say, across all these 6 provinces, we also went to places that perhaps never catered for this. And if you look at some of the photos that we have, when you look at the mountain of documentation that's piling up in the areas where the health workers are working, you can see that there wasn't any systemic process that was put in place in the first place. So this is one of those that we're saying, if part of the expenditure, especially the facilities we went to, were some of them in rural areas, some of them in urban areas, but there were about 109 in total of them that we visited. And you find different issues pertaining to this, where at a local level in a hospital or a clinic, the type of disciplines that are expected to produce accurate inventories for pharmaceuticals are not always easy to get to the bottom of. If I may just give a sense in terms of the total number of spend for this period that we looked at, in total the procurement was about 16.8, I think. 16.8 billion of procurement covering all the 9 provinces. So there's a huge amount of resources that goes in there. And the reason that we are raising the issue of lack of the disciplines in inventory management is that when you then have to assess at a provincial level the stock requirements, you've got no idea the extent to which you've got a stock out, and some things get ordered and they kept in storage, and because they are not properly stored, sometimes they expire because they've got an expiry date, and then you've got to go back and procure again, when in fact you didn't manage your stock properly. You probably have that product somewhere in the storage, but if you don't have a proper management of the movement of stock, you've got a bigger problem of having to order things that will expire without them being used. So those are some of the issues that we have detected, and we don't want to prescribe a solution, but I think it makes sense that when things are brought in and taken out, there must be a record to prove where they went and how.
Thanks, AG. We'll take the second set from here. Any further questions?
I quickly just, Amina Akram, SABC Economics. In one of the reports, you've highlighted that these medications get expired and in the process find themselves in the hospitals. So I don't know, did you make recommendations for government to probably do another stock take, or in terms of patients getting expired medications, or how bad is the situation in terms of patients not getting the required or expired medications at the government hospitals?
Cape Town, any further questions?
None from us. Thank you.
Thank you for that last question. As far as this matter is concerned, we're raising the risk that when there are no proper controls in the movement of pharmaceuticals, you also run the risk that you could put it into the system when it actually has been expired. So there's 2 elements to this. One is to fix that issue, but secondly, the people who are trained clinically need to be the ones that need to look closely at this matter, especially the pharmacists. And I think it's a double whammy, because in some of these areas, you do not even have that person who is accredited. They are relying on a district office in some places, for example, for support. And that support will probably come to some of them once a month in terms of giving them the up-to-date knowledge on some of the management of these pharmaceuticals. So I'm not too sure if you want to add to that, Kivesh, but the reality is that it continues to be a risk that when you've got expired medication that's not properly controlled, it could find its way into somebody at the dispensary.
Thanks, AG. No, you're 100% correct. I think AG has covered it adequately. We're raising the red flags around the expiry of medications and the control around these medications, temperature control, storage requirements, etc. So these are the flags that are raised and the risks that face the departments. And yes, the department is looking at these and putting processes in place to actually correct these. And I think it's encouraging to see that. So I think the situation in the department with getting the right resources, it will adequately improve in the future. Thanks.
Maybe if I may just come back to reinforce the point. If one looks at this report, the one that says pharmaceuticals management on page 48, that's what I meant when I referred to the pictorial depiction that we're using here. And typically one of the things that we asked the teams to look at was exactly some of the issues that evidence the potential risk. Because if you look at some of them, the exposure to the elements is what could also cause it not to still be usable after the time that it was meant to be. So there are many situations here where we look at this and we think that something better can be done, let alone the fact that some of them have got limited capacity, limited infrastructure, because they never really had a budget to provide for infrastructure. Some of the issues, for example, in the dispensing of medication also revolve around: did you create sufficient movement and environment for people to queue for this medication? Because some of them, they queue for long hours in the rain and all of that. And these are some of the attributable reasons that go back to the planning to say the distribution of pharmaceuticals is not so much only about the fact that the medicine is available over the counter, but people wait for it. And sometimes they wait for it in conditions that are not sustainable. So these are some of those hygienic issues in addition to the core findings as far as the operations are concerned. Thanks.
Colleagues, the last chance before the AG does a roundup. I'll see you, Sipo.
My name is Sipo Mabena for the Times newspaper. AG, the flaws and the challenges that you have identified in the management of pharmaceuticals, and with particular the challenges at the health institutions, how does this impact on the piloting of the national health insurance?
We can't hear you, Sipo. Can you?
Sorry for that. Sure. Let me just take it from the top. AG, the flaws that you have identified in the pharmaceuticals and also the storage of medicines in the health institutions, how does this affect or impact on the piloting of the national health insurance scheme? Thank you.
Okay, so any last question from your side?
No, we are covered. Thank you.
Thanks.
As far as that last question is concerned, clearly, if I follow the conversation around the NHI, this is possibly one of the building blocks for it, and I think it speaks to access to the right medicine at the right time. And really, we didn't do an impact assessment. All we know is that this is one of the ingredients. So if one of the ingredients is already showing some fault lines, some of which have been addressed, the question is that it potentially also needs to be dealt with alongside the development of those long-term plans around NHI, because this is already an operational environment where medicines get distributed every day. And I think it's also about saying how can we bring about the desired improvements in managing pharmaceuticals so that when the rollout of NHI takes place, it finds systems that are already robust enough to provide sufficient assurance that medical pharmaceuticals are dispensed at the right level. So I think these can coexist for as long as we say we have identified the weaknesses and that the leadership in the healthcare system has already responded and is keen to respond to this. And I think it could be a win situation. Lastly, if I may just in wrapping up, what is contained in our media earlier brief was really to try and extract at the highest level possible to draw attention to some of the key instruments needed for faster and efficient delivery of services as we have identified in these reports. But we believe that the value that is going to come from it is when actions are taken to fix these issues. But secondly, from a reporting point of view, we would also think that once you go deeper into some of the key issues in the report, it will be much easier to surface a proper reporting around it, because what we've done in the media release was really to pick up the high-level conditions that we felt were common across all of them. But you will see some unique examples of things that happen in specific projects when you go deeper into the report, and we didn't complicate it. We really try to follow a value chain. For example, in the water supply one, it starts with where do you extract the water from the river, and how does it get to the water treatment plant, and how does it get through the waterworks right up to the reservoir. And what happens once the water has been extracted and is now in the reservoir? In most instances, you'll find that nobody drinks the water, because the part that has to do with the reticulation system from the reservoir to the taps in the various households is potentially that which has not been budgeted for in some instances, or has not been done yet, which means that even if you look at that situation from a financial audit point of view, and that's why sometimes when we have to deal with the relationship between a statutory audit outcome and service delivery, you end up with these weaknesses in some places. You might find that that particular amount spent up to the reservoir, there was nothing faulted with it. But the reality is that you may give that particular entity a unqualified audit with no findings, but in the meantime, the people there do not drink water. And the reason is not because that money which was given to them would all have been lost in that instance, but the people who were supposed to connect to their debts did not provide the budget for it, and therefore they must wait a little longer before they get water, even though that municipality which spent on the rest of the bulk infrastructure would have done it in appropriate ways. So all we are saying in conclusion, therefore, is if one looks at this performance audit report, it is about providing an enhanced set of insights into some of the issues that we've also been reporting on as far as the regularity audit is concerned. And so the two, if they are linked, one will be able to have a better appreciation of the fact that things do not work is not so much only about financial management discipline. Some of these issues of irregular or wasteful expenditure are also caused by lack of proper rigor and project management and supervision over those projects when they get delivered. So we hope that this will trigger the required momentum over time to also apply these disciplines in other projects, because they tend to be subjected to similar conditions most of the time, even though they happen at different places. So thank you very much, and we hope that that will provide the needed clarity in taking this matter to the next level. Thank you.
Colleagues, thanks very much for your time. And before you rush to your newsrooms, there's a light lunch served. And those who have arranged post-briefing interviews, the AG will be able to talk to you shortly. Thanks. Thanks again.
All right. Thank you. So too many reports here. I'm not going to put all of them. Too many reports. No, but they are very much linked to each other if you think about it. How are you?
Okay, thanks. I just need a quick summary for our listeners, just highlights the findings as well as recommendations.
Oh, thank you very much. What we did in this report was really to look at the things that we believe need to be in place in order to deliver projects properly. The one project what we looked at was how pharmaceuticals get delivered from the time they are ordered right up to the dispensary, at any dispensary in the clinic. And we found a lot of issues pertaining to lack of pharmaceutically trained people, lack of proper processes and standard operating procedures and all of those type of things. But we also found a lot of medication that is stored in warehouses across many of these provinces not properly because medication is sensitive. Some of it can expire, some of it is no longer usable after a while. However, government commits funds to buy medicines in order to improve healthcare, and some of the deficiencies are the ones that we believe the Minister of Health has given attention to, but more needs to be done to effect improvement there. As far as the water infrastructure is concerned, again, it goes back to the issue of the budgets. Many of them were not adequate to meet all the needs, but also there were operational weaknesses that were found as some of these projects were delivered. A lot of them have to do with the fact
break.